Glenn here with Ethan Grauman, Excel Physical Therapy at our 132nd and Maple Street location. Some of the common questions that we typically get asked are when to use ice and heat for different related injuries, general aches and pains. Right now is probably a good time with that, with the fall sports kind of kicking into gear here in the near future. So I thought I'd kind of touch base on the differences because there are some advantages to using one or the other for different reasons. Typically in regards to the ice, I like to use it for acute pain and to control inflammation. Typically after an injury there's going to be an inflammatory response. So if you can minimize as much inflammation as possible, it's going to help pain control. From an acute standpoint, depending on the severity of the injury, you're looking at usually between 24 to 72 hours. But again, depending on the severity of the injury, you may have some swelling and inflammation longer than that, that you may need to use ice for longer periods of time. In regards to heat, typically what I recommend for heat is more to increase blood flow to the area and for tissue relaxation. A lot of times you just have general aches and pains, some tight muscle tissue. So a lot of times heat's going to be best for that as far as increasing the blood flow to that tissue and help with the healing response. So a lot of times, you know, if you've had an athletic event the night before, the day before, that next day, if you just have general aches and pains, you know, you didn't necessarily got injured or anything, heat's going to be a good avenue for you to approach in that regard. In regards to application, you typically want to make sure that there's a barrier between the skin and your ice or heat. So a lot of times we'll recommend putting like a pillowcase, a towel, even just some clothing over the area, injured area. You want to make sure that you surround the area that you're applying it to. Again, if you have sensation issues or anything like that, you want to maybe check the skin periodically. Usually recommend about 15 minutes with application. And again, just make sure there's a barrier there. The last thing you'd want to have happen is a burn to the tissue. So the big thing in summary, if you see inflammation, swelling, redness, warmth, ice is going to be your best adjunct as far as the modality goes. If it's more just the general achiness, soreness, tightness of tissue, heat's going to typically be better. Again, this is just some general philosophies. Everybody's a little bit different as far as how they heal, but just kind of some general things to think about. If you have any questions with what I just spoke about or anything in general from aches and pains to any of your injuries, feel free to contact any of our 13 Excel locations. We'd be happy to answer any of your questions.